Christina Fennell, the President and CEO of Mental Health America Wisconsin, and we are really excited to be a recipient of a LIHF grant this year. Mental Health America Wisconsin was formerly Mental Health Association. We've been around for 81 years, and our main focus areas are advocacy, education, and service. One of the projects, or the project that we're being funded for this year has come out of our Strong Families Healthy Homes program, and that's a program that works with families where the parent has a mental illness. We also do a lot of suicide prevention work statewide, a lot of policy work statewide, a lot of education, as well as information and access, information and referral services here as well. So that's a little bit about what the agency does. We're also part of a national affiliate. There's 333 affiliates throughout the country. So we're part of a larger effort, a larger cause.
My name is Carissa Vogel. I'm the program manager of our Strong Families Healthy Homes program. This is the program that is funded through the LIHF grant. What we're going to be doing is kind of piloting this program and gear it towards pregnant African American women that are in the specified zip codes in Milwaukee where the infant mortality rates are the highest. This program has been around for about 12 years now, almost 12 years I believe, and we know that it works and we've seen evidence that it works, but unfortunately our program has never really been evaluated in the way that this grant is going to allow us to be evaluated, so we can figure out what it is we're doing that actually works. It's an intensive in-home program where we provide therapeutic services to the entire family, whoever that mom identifies as family, whether it is the father of the baby, a friend, a cousin, whoever that may be, so we can involve the entire family in our services. In addition to the therapeutic services, we also offer case management that can be an array of things, transportation to prenatal appointments, budgeting, grocery shopping, as well as peer support and having an additional support from a woman who has mental health issues herself, who's also a mother, and hopefully help them kind of increase their community support so that they can feel successful. So some of the goals of the program would really be to help reduce prenatal stress, increase supports, increase resourcefulness of the mom so she feels like she can get her needs met, and hopefully thereby decreasing her mental health symptoms, which then would hopefully help increase positive birth outcomes.
In regards to the community action plan, you know, there's really a lot of talk about expanding access, expanding services, and really reaching all members of the family. And that's something our program really does well, is we want all members of the family to be involved in this pregnancy. And so that's something we really strive to do. And our family advocates in working with these moms will ensure that services are found. And as family advocates, that's really what they are, is they're an advocate for the family. And so they will advocate to find access or to find the appropriate services that that family needs. These parents are going to be the drivers. They're going to be the drivers of the bus. We're going to be along with them and pushing them along and helping them find those services and that access. So I think it fits in really, really nicely with the community action plan. And really, you know, there is no health without mental health. We can't ensure a healthy birth outcome without taking a look at the mental health of our moms. And so again, another really great alignment with the community action plan that LIHF has in place.
And like Christina had just said, you can't focus on health without mental health. Everyone has mental wellness, everyone has medical wellness that we need to take care of. And really, our program, Strong Families Healthy Homes, is the only program in the state that offers the services that we offer, and that specifically focuses on parental mental illness and helping the parents understand what's going on, how can I take care of myself so that I can take care of my family and be there for my family. So I think, you know, the program that exists is already very innovative and very important for our community. But now with this pilot program, it's almost another niche in the community. Parents with mental health issues who are also pregnant. And these mamas are going through all kinds of changes as they go through their pregnancy and trying to deal with what that might mean for them and how they can adjust to now being a new parent. And our program can hopefully be there for them to help them figure that out.
And I think to add to that, so most of the moms that we deal with, and not all the moms that we deal with, want to be parents and can be incredible parents, but they need the appropriate supports, the appropriate resources in order to do that. And so often these families are forgotten about until they're part of a larger system like our child welfare system. And then when they're part of that system, they have those resources available to them, but there's so much additional trauma that has already happened to that family when those children are separated from the home that this is really a preventative approach. We want to work with this family, we want to work with the mom, give those moms the supports and resources she needs before she's part of a larger system like that. So part of it's really finding those families who haven't been involved in a system, who haven't been involved in a service and really do need that additional support that we can provide. Maybe I'll just answer the last why we're excited about this project. As Chris mentioned a little bit earlier, one of the reasons we're so excited about this project is the fact that we'll be evaluated for the work that we're doing. We have some outcomes. One of our outcomes that we're very proud of is that we have a reunification rate of 85% of those families that successfully complete our program. So we know that the work that we're doing is effective, but we don't have any research or any evaluation to back that up. So one, that's going to be really helpful. Two, we know what we have to offer is really valuable to the community. We're a small program, so we do not work with a large amount of families and serve a large amount, especially because it is so comprehensive and so intense with the families that we work with. So this will really allow us to serve that many more families in Milwaukee County who really need our support and assistance and haven't been able to receive it up to this point because they haven't had a funding source. And we have Christy Johnson here, who is a participant of our Strong Families Healthy Homes program and is now a valuable member of our team. She's a peer specialist with us. And Christy's just going to share a little bit about her experience in this program and how she feels as though this grant and this program is going to help others like her. So.
Okay, I'm so excited that this program is going to be available to mothers that are pregnant. My last pregnancy, I was involved in Strong Families Healthy Home, and I found it very valuable to me. I myself have mental illness, I have bipolar, and just being in this program because they get it, they understand what you're going through, and it's such a support to have someone there to be with you. You know, the family advocate just was such a support. You know, she went to me with doctor's appointments, we talked, we discussed, you know, it was a very hard time for me and very stressful. And without her, I called on her before I called on my mother. I mean, when I went into labor, that's who I called. And she came right away, you know, she held, you know, she was holding my hand, you know, crying, you know, and it was just such a help, you know, to me, and, you know, and she was there after I had him too. And this program is like, you know, it's like a crib, you know, they're around you and supporting you, you know, when you need it. It was just, you know, a value to me and my other two kids at that time. I didn't know what I was going to do. I wasn't really, you know, mentally prepared, and by just being here, going to family nights, doing the groups and stuff, really prepared me for the third child, and, you know, and helped me. And during that time, you know, I got reunified with my other two kids, and they were all there. And turned around and gave me a chance to help other women and to be there and be a support and a listening ear as they were for me. And, you know, so I'm just really excited that maybe I can be able to do something that this organization have done for me for someone else.